Okay, let's dive right into this explainer with a true medical mystery. It's a really dangerous myth that our bodies will always give us a clear warning sign when something is wrong. Sometimes they stay completely silent for years. We honestly can't just rely on how we're feeling or wait around for some obvious symptom to pop up. Everything we eat and drink is processed by our kidneys, and when they start to struggle, the signs are often hiding in plain sight, specifically right on our faces.
Picture this. A 25-year-old walks into the emergency room with puffy eyes. The doctors just hand him a water pill to clear out the fluid and send him on his way. No urine test, no kidney test. Well, just 5 minutes later, he was back. And the reality, he was actually an advanced kidney failure. His kidneys were silently leaking protein directly into his urine. It was a massive red flag, completely missed until someone finally did a proper analysis.
So let's move into our first main section, the silent thief. The kidneys are incredibly resilient, but as you'll see, that's actually kind of a terrifying curse.
Get this, you can literally lose up to 90% of your kidney function and feel absolutely nothing. Take a second to really think about that. You could have serious puffiness around your eyes, but you won't feel tired, you won't feel sick, and you won't feel any pain whatsoever. Your kidneys are just in there, quietly absorbing the damage.
And because of this silent decline, we are looking at a problem on a massive scale. Right now, 35 million Americans have chronic kidney disease. But because the kidneys are so insanely good at compensating and adapting, a staggering 85% of those people are completely undiagnosed. The vast majority of them are walking around in serious danger, and they have absolutely no idea.
To figure out why this happens, we have to look at the mechanics. Your kidneys are basically just complex filters. A healthy filter keeps all the vital proteins circulating right in your blood where they belong. But when these filters get damaged, they start to look like Swiss cheese. They get literal holes in them. And when that happens, the vital protein slips right through into your urine. Without enough protein to hold the fluid in your blood, that fluid leaks out and starts pooling into your tissues.
Which brings us to our next section, 4 clues in your eyes. Since our kidneys suffer so quietly, our eyes actually become the true windows to our internal health.
We've got a diagnostic roadmap of 4 specific visual clues right on your face: puffy eyes, pale or red inner eyelids, yellow eyelid patches, and white corneal bands. Let's break these down to help you spot trouble long before you ever feel sick.
First up, puffy eyes. If you remember that 25-year-old from our opening story, this puffiness is one of the absolute best, most immediate early indications that your kidneys are in distress. Because the skin around your eyes is so incredibly thin and delicate, it's one of the very first places you're going to notice that fluid backing up when your Swiss cheese kidneys start letting protein escape.
For the second clue, here's a super simple test you can literally do in your bathroom mirror right now. Pull down your lower eyelid. The inside should be a nice healthy pink. If it's a gray or white color, that points directly to anemia, which is heavily correlated with kidney problems. In fact, 60% of people on kidney dialysis have severe anemia. On the flip side, if that inner eyelid is bright red and irritated, it points to severe blood sugar issues, which is a primary driver of kidney failure.
Okay, our third clue comes in the form of small yellow bumps right on the eyelids themselves. And no, these aren't just skin tags, they are pure cholesterol deposits. Why are they there? Well, our body systems are all deeply connected. When your failing kidneys start rapidly losing protein, your liver panics. It goes into total hyper-overdrive trying to compensate. This results in massively elevated cholesterol that ends up depositing visibly right there on your eyelids.
And our fourth clue really shows how a failure in one single organ cascades through your whole body. A white band can actually start forming across your cornea, the clear front part of your eye. Healthy kidneys help maintain your vitamin D levels, but when they fail, your vitamin D becomes wildly dysregulated, and that totally confuses your body's calcium management. The result? Calcium starts building up in all the wrong places, forming visible white bands right across your eyes.
All right, let's move to section 3, beyond the eyes. There are a few key non-visual symptoms that also act as blaring yet totally silent alarms.
You've really got to pay attention to your daily habits. For example, if you're seeing foam in the toilet, that is literal protein escaping your body. If you press a finger into your ankle and it leaves a dent that just stays there, which is known as pitting edema, that's the exact same fluid pooling we saw with the puffy eyes, just pulled down to your feet by gravity. And if you're waking up 2 or more times a night to use the bathroom, your kidneys are actively struggling to hold urine.
Moving right along to section 4, the root causes. Now that we know what clues to look for, what are the actual daily habits and underlying conditions that are secretly destroying our filtration systems?
The absolute #1 cause of this mechanical damage is high blood glucose, especially from diabetes.
Think about that high sugar circulating in your blood. It acts literally like rough sandpaper, just grinding through and tearing up those delicate filters. Combine that with high blood pressure damaging the tiny filtration units, popping regular painkillers like ibuprofen, and a diet full of junk food and alcohol, and you are just constantly hammering your kidneys with an immense toxic load.
Which brings us to our final section, taking action. Here is exactly what you can do about this right now, starting with some super affordable testing. You want to catch this stuff early, right? Like way before you hit stage 4. To do that, just ask your doctor for these 3 simple tests. First, the eGFR test, which directly measures how well your kidneys are filtering. Second, the UACR test, which checks the ratio of protein leaking into your urine. Both of these are usually under $30. And, of course, get your blood pressure checked to make sure you aren't silently stressing out those tiny filtration units.
When it comes to your diet, lifestyle tweaks are a real game changer. Intermittent fasting is one of the absolute best things you can do to pull your kidneys out of danger and finally fix that annoying frequent nighttime urination. Pairing that with a low-carb diet removes that sandpaper glucose effect we just talked about. But a major caution here. While vitamins like magnesium, vitamin D, and potassium are awesome for prevention, if you are already in advanced stage kidney disease, you absolutely must consult a doctor before taking high doses. Your body just can't filter them properly anymore.
Ultimately, we have to realize that we're basically like fish living in a toxic tank. Welcome to the modern world, where everything around us, from the screens we watch to the heavily processed food we eat, is totally engineered for dependency. Rather than just relying purely on exhausting willpower to fight off kidney disease, we've got to change our daily environment to make the good habits easier and the bad habits way harder.
So knowing how silently and completely kidney disease can steal your health, and knowing the clues are hiding right there in your eyes, I have to ask, are you going to keep battling individual symptoms with quick fixes? Are you finally ready to clean the tank and change the very environment your body lives in?